Hello everyone, my name is Yvette. I've been working as a registered nurse for 2 years and currently enrolled at Frostburg State University, completing my bachelor's degree in nursing. We were asked to choose a topic for a service learning project. I've chosen to discuss the higher incidence of hypertension or high blood pressure in African American men. My presentation will focus on a 2.5-year study funded by the CDC and State of Pennsylvania, performed in the northern and western parts of Philadelphia. This presentation is aimed at providing statistical data and facts and providing brief education on how to manage or control your high blood pressure. Always consult with your physician and follow their orders to better control your hypertension. The information collected for this presentation is from a study named SHAPE-IT, which stands for Stroke, Hypertension, Prostate Education Intervention Team. The SHAPE-IT program is a collaborative effort between Pennsylvania State Department of Health and the CDC, Center for Disease Control, which targeted reducing cardiovascular events in African American males 35 years of age and older in northern and western Philadelphia. SHAPE-IT fosters strong relationships with participants from faith-based organizations, barbershops, beauty salons, and clinics to recruit men for this study. These men were given incentives for participation in an educational session about reduction of cardiovascular complications at community events. The incentives included raffles to win prizes such as bicycles and home exercise equipment in community events. Education consisted of lectures, videos, handouts, and blood pressure readings. The mission was to collaborate between community organizations, community members, and healthcare providers in order to create interventions and promote strategies to reduce cardiovascular complications in the targeted group. Here is a map of the particular parts of the city where SHAPE-IT implemented the study. 25% of the population of 27,000 African American men ages 35 years or older in targeted zip codes of Philadelphia included 900 men who were reached with the comprehensive small group workshop. The Project Advisory Council consisted of community members and organizations with men who had hypertension and were prostate cancer survivors. They played such an important role in recruiting participants into the program. The participants were able to relate to these men. The PAC developed action plans which consisted of developing a shared responsibility model, community health planning, establishing partnerships, broadening cultural competence, and relevant activities. The goals and objectives of SHAPE-IT are as follows. Develop interventions for community to reduce stroke and prostate cancer prevention. Identify an action plan to increase awareness, change attitudes, influence behaviors, and to promote social change process related to hypertension, stroke, and prostate cancer prevention. Identify participants' attitudes, beliefs, barriers, and assets related to education, prevention, and treatment screening recommendations. This is a table showing the differences in rates of death due to hypertension in African American men, women, and white men. This table depicts statistics on a national level in order to portray the higher incidence across this nation. Changes in death rates from essential hypertension from 1999 to 2004, as shown above, follow the same pattern as hypertensive disease overall. In each year, death rates for African American men were higher than those of white men and lower than those of African American women. Rates for white men and African American women generally increased annually, but rates for African American men fluctuated during the period. This depicts these data and shows the rates were substantially higher among African American men and women than among white men throughout the period. As a result of program participation of a subset of 173 men, the main indications for a higher rate of hypertension in African American men were because of lack of knowledge, attitudes and behavior towards disease management, and lifestyles such as poor diet and lack of exercise. 2 months preceding the conclusion of the study of 181 men, 86% scheduled appointments to see their provider, 87% monitored their blood pressure, 68% included exercise as their daily regimen, 73% ate more fruits and vegetables, 81% reduced salt consumption, 92% took their blood pressure meds as prescribed by the physician, 20% quit smoking, 74% reduced fat in their diet, 52% managed their stress, 45% limited their alcohol consumption, and 37% lost 5 or more pounds. The top 3 health concerns for African American men in Philadelphia are stroke, hypertension, and prostate cancer. I chose to focus on hypertension specifically among the other health concerns listed because it is a gateway to a series of cardiovascular complications if uncontrolled, such as stroke, heart attack, heart failure, kidney disease, peripheral vascular disease, and vision loss. First, let's explain exactly what blood pressure is. Blood pressure is the force of blood against the wall of the arteries pumped by the heart. The top number, systolic reading, reflects the pressure when the arteries are contracted, and the bottom number, known as diastolic reading, measures the arteries at rest between pumps. The healthy range in adults for systolic blood pressure is less than 120, and diastolic blood pressure is less than 80. Too low can be considered hypotension, or low blood pressure, which is also dangerous because there is not enough blood and oxygen perfusion to tissues and organs. However, hypertension means the force of blood flow is too strong and puts too much pressure on the heart, arteries, and various organs. Years of hypertension and high pressure can lead to the heart overworking, causing heart failure. To help you better visualize the arteries, you can think of the arteries as a rubber band. Constant stretching over time wears on the elasticity of the rubber band, causing it to snap or break. This is exactly what happens to the tiny vessels in your eyes, kidneys, or even brain, thus causing vision loss, kidney failure, or stroke. Over time, uncontrolled hypertension can be very detrimental to your body. I chose 3 nursing diagnoses and interventions pertaining to hypertension. Knowledge deficit related to lack of information about the disease process and self-care. The nursing intervention for that would be to provide education related to hypertension, risk factors, how to manage disease through diet, exercise, and medication. The second one is ineffective tissue perfusion, cerebral, renal, cardiac, related to impaired circulation, which is brain, kidney, and heart. The intervention for that would be to measure blood pressure on a regular basis, no baseline, and treat with antihypertensives as prescribed by MD, by the physician. The last one is risk for decreased cardiac output related to increased afterload, vasoconstriction, myocardial ischemia, and ventricular hypertrophy. The intervention for that would be to take the antihypertensives or blood pressure medications prescribed by the physician, implement lifestyle changes in conjunction with medications. The top nursing diagnosis I have chosen to focus on is knowledge deficit related to lack of information about the disease process and self-care. I chose this because oftentimes hypertension is called the silent killer. Many people do not understand the seriousness of this disease because they feel fine, meaning they have no symptoms. Even though high blood pressure may not make you feel ill, it still has damaging effects internally when uncontrolled that are not seen physically. So because of that, it is hard for people to believe the damaging effects if they are not physically seeing them and are not educated enough about high blood pressure and the risks associated. The two goals I chose through this PowerPoint were to provide education on risks associated with uncontrolled hypertension, such as stroke, loss of vision, kidney disease, peripheral vascular disease, and heart failure. And the second goal was that this video will stress the importance of learning how to manage this disease and follow up with the doctor. I chose these goals because they are attainable. In order to maximize control of your hypertension, first we must understand the risk. Then to take it upon yourself to consult with your physician to learn how to manage this disease, usually with medications, changes in diet, exercise, and lifestyle changes. This is a brief overview of diet guidelines for hypertension control. I obtained this information from the CDC and choosemyplate.gov. Limit intake of cholesterol, saturated fats, salt, alcohol, and quit smoking. Please refer to www.choosemyplate.gov or CDC for additional information and resources that goes further in depth about diet. And again, always consult your physician before starting any new diet regimen. Regular exercise is also vital when trying to control hypertension. The Surgeon General recommends at least 2.5 hours of moderate to intense exercise per week. Exercise is beneficial because it strengthens your heart and cardiovascular system, improves blood and oxygen circulation to vital organs and tissues, helps reduce body fat, helps reduce stress, anxiety, and depression, improves sleep, and makes you feel more relaxed and rested. The Surgeon General's recommendations of regular exercise is advised for everyone, not just people with hypertension, and it can significantly help with the management of other diseases as well, such as diabetes. You can visit the CDC website for more information on exercise as well. If you have hypertension, your doctor will most likely prescribe medications to help control your blood pressure. There are a multitude of different types of medications for high blood pressure. Please consult your physician for the most appropriate medication for you. Always take medications as prescribed and inform your doctor of any abnormal or uncomfortable side effects. The last note I want to add is that it is absolutely important to be your own advocate. You need to do your own research whenever you have been diagnosed with a disease or prescribed new medications. Take it upon yourself to understand what is going on in your body and learn how to live a healthier life. Be your own advocate. Arm yourself with knowledge. I hope you all enjoyed this presentation and learned a little bit about hypertension and how to manage it. Here's a list of my references, and remember to always consult your physician. Be knowledgeable of whatever you've been diagnosed with hypertension, or if there are other issues such as diabetes. Do your own research and talk with your doctor and take care of yourself.